Hello, today we are going to talk about the use of CT angiography and perfusion in the evaluation and treatment of acute ischemic stroke patients, addressing both standards and potential pitfalls. My name is Edward Sloan. I work with fern.org. I'm Professor Emeritus at the Department of Emergency Medicine at the University of Illinois at Chicago in Chicago, Illinois. I also am Medical Director for New Rose Healthcare Management, helping the emergency department at Roseland Community Hospital in Chicago, a safety net hospital. And I serve as Medical Director for the Physician Assistant Studies Program at Dominican University in River Forest, Illinois. This information is being presented at the Clinical Decision Making in Emergency Medicine meeting, June of this year. I want to give my thanks to Joan Esbrey-Cullen, Andy Godwin, Andy Jagoda, Ginia Ports, and Scott Silvers, with whom I've worked at this good meeting for several years. I have no financial conflicts. I serve as the Fern President and Board Chair. This slide includes a link to the social media sites that will allow you to access this information and information regarding other emergency illnesses and injuries in patients with neurological problems. Fern.org is our website. The educational objectives as we discuss the use of CT studies in stroke patients are as follows. We'd like to enhance your understanding of the pathophysiology of acute ischemic stroke. We will allow you to better understand what are CTA and CTP and how these tests are performed. We'd like you to know when CTA and CTP are indicated in the diagnosis and management of acute ischemic stroke patients and how patient outcomes are influenced by this testing. We'd also like to review the AHA-ASA guideline and recommendations made with respect to neuroimaging for acute ischemic stroke patients. We will conclude with the role of NCCT, CTA, CTP, and all neuroimaging for emergency department stroke patients. And we'd like to make it possible to learn based on key clinical questions.